Everyone does price comparison, whether you're buying a car, a TV, or choosing a place to live. And when you don't price compare, you can make poor decisions. And in US healthcare, that can mean bankruptcy or losing your home. Hi, everybody. Nice to meet you virtually. My name is Ahmed Marmoush. I'm the CEO and founder of Handl Health. In 2019, I lost my dad to lung cancer because my family couldn't afford the life-saving treatment that he needed. After he passed, I not only had to deal with the emotional grief, but also with the financial impact and burden of the never-ending medical bills. Now, unfortunately, my family isn't unique in this situation. In America, tens of millions of people go without access to critical care due to cost, despite the fact that prices for the same services vary hugely. Everyone does price comparison, whether you're buying a car, a TV, or choosing a place to live. And when you don't price compare, you can make poor decisions. And in US healthcare, that can mean bankruptcy or losing your home. So I ask you this: in what world should we rely on crowdfunding websites to pay for outstanding medical bills? In what world do we have to tweet out and like our support to save someone's life? This is the unfortunate reality of US healthcare today. But thanks to new laws, our healthcare system is moving towards a transparent and free market. For the first time in US history, we've been able to access every single price for every single healthcare service that is available across the nation. Now, the challenge lies in the way this information is published. It is so complex and jargon-filled that it makes no sense to the average person. To give you a sense of scale, one of the 6 major national insurance carriers in the US has published 99,000 files with over 300 billion price points. Yes, that is 1,000 times the size of the US population. Now, thankfully, we brought together a team with expertise in ingesting huge data sets and deep knowledge in calculating how healthcare gets paid. I'm a pharmacist by training with deep healthcare business experience off the back of a decade in consulting. My co-founder, Ria, is a Wharton graduate with a data science background, having built outcomes-based contracts for Big Pharma. And my co-founder, Karthik, is a big tech engineer, having led the development of big data platforms at Google Cloud and personalization efforts at Meta. And we've taken this data and transformed it into a price comparison engine. And while such technology has so many potential applications, today we started by helping our employer clients negotiate smarter benefits plans and their employees shop for healthcare services. With less than 3 clicks, an employee can compare the cost of a service or a procedure and make an informed choice about where to get that care. In fact, by simply shopping around with Handl Health, an employer and employee can save an average of 28% on their medical costs. And our business model is simple. We align to the industry best practice of a per user per month fee that our channel partners, such as health benefits vendors, benefits consultants, and third-party administrators, bake into their clients' fees, creating a win-win relationship. Since launching our MVP in May of 2022, we've booked over $700,000 in revenue, working with our channel partners who integrate our solution into their digital front door to serve over 30 employers covering 30,000 individuals. So our ask of the audience today is to build awareness on the importance of price comparison in healthcare. We're looking for introductions to benefits consultants and health benefits platforms that can help us spread our technology to the millions of employers and employees who can be informed, empowered, and savvy consumers of healthcare. Thank you.
Ahmed, great presentation. Thank you so much for sharing your mission with us. You know, there's a lot of people who have been talking about price transparency for a long time in healthcare, and no one seems to have been successfully to execute in this space. But there are some players in there. Like, how are you different? What's your defensibility? How are you going to succeed where they failed?
Thanks, Jamie. So I do agree with you. I think price transparency has long been a dream. And we believe that the legislation has brought about a fundamental shift and an opportunity that hasn't existed before. Now, While the data is complex and difficult to mine, we think over time that it will become democratized. And actually, we're one of the companies that are trying to enable that because we think that will spur innovation. Our differentiation really comes down to the data science in our team. And we've tailored this to serve the specific needs of the self-insured employers. So we handle the complex data sets and we string them together to build a proprietary product that makes the analytical complexity simple so that every person can understand what this information is telling them and gather the insight they need so that they're able to make more effective decisions around their healthcare.
Thanks, Ahmed. Really quickly, there was a question from the audience, which was, can you show again the last slide with the ARR info? And what are your plans to raise in the future?
Yeah, sure thing. So in terms of our revenue today, 50% of our revenue was a fixed fee agreement with our existing client to be able to build our technology. This was the MVP. Then we were able to license that product out for another contract of $400,000 in ARR, really to use our solutions. In terms of our raise plans, while we're not actively raising today, we are currently part of the Techstars healthcare program based out of LA. And that is due to wrap up with a demo day come around June. And we're planning to really focus on our traction efforts in the next 2 months with the view to raise a seed round at the end of that.
Ahmed, we're going to go through and put the poll up right now, but is there any last message you want to leave for people on the call today?
Thanks, Jamie. I think really, I come from not the US, but New Zealand, where universal access to healthcare was something I took for granted. Americans don't have that luxury. And we believe that through bringing transparency around the cost of healthcare, we can at least empower every employer and employee or consumer of healthcare to make better choices in line with what they can afford. And we're excited for people to join us on this mission to really transform healthcare and how healthcare is paid in the US.